And what kind of therapy? Obviously, it depends on the surgery, it depends on the fracture. We talked about a broken ankle. What kind of rehab, physical therapy, is one looking at when something like that happens?
I tell patients all the time, I can do a perfect job. I can follow textbooks and journals perfectly, but really at the end of the day, what's going to make you better is the work you put in to get better. And the physical therapy, I can't stress enough the importance of exercising and moving the joint that was injured. Once we stabilize that bone, the whole point is to get that joint moving, because really what ends up causing problems is stiffness. You try to get out of bed and you just feel stiff, or you can't move your ankle, your wrist, your shoulder to be able to reach up and comb your hair, or to be able to wash yourself, to be able to brush your teeth. And little tiny things like that have a profound effect on the way you live your life. And the therapy, there's almost nothing that's more important than the therapy after an injury.
And many of us are surprised when we have to do that surgery, where the surgery happened today and the therapy, I should say, let me correct myself, and the therapy begins sometimes that day or tomorrow, and the patient's going, what?
Yeah.
You want me to get up now?
Yeah.
It's pretty fast, isn't it?
I want you to get up now.
Right now.
I want you to get up.
Why
You know
do we need to get up right now?
You know why? Because yesterday you were able to get up now, and the body wants to get up now. The more we keep your body from getting up now, the more you're going to feel those effects long term. And the most important thing that I think happens in the field of orthopedics is we figure out what can we do to stabilize things well enough to get you moving now.